The surgical company specializes in the development of innovative solutions for healthcare professionals in various fields of expertise, including patient temperature management. Since our founding in 1993, we have built up a high level of expertise in the field of perioperative hypothermia. We now offer a wide range of patient temperature management solutions like Mistral Air, Fluido, Thermoflect, and Fluido Irrigation. Surgical techniques for endourological procedures keep evolving to comply with today's standards. New procedures often take more time to achieve optimal results. For longer procedures, warming irrigation fluids, which contribute to patients' outcome, becomes even more important. We asked urologist Dr. Frank D'Ancona his opinion about the importance of warming irrigation fluids during endourological procedures.
Well, the importance of irrigation during endourology is very high. You need the irrigation for a good and secure procedure. You need to see the mucosa very good. So whether you are in the bladder, in the prostate or in the kidney, you need to have a good view. So irrigation is good to have to create space and to see the mucosa. But also you need to do something there. Whether you resect tissue or coagulate there or treat a stone, you need the good irrigation to have a good view. You need to avoid blurred vision. You need to transport energy, electric energy or laser energy. So it's very important to have a good irrigation on a good flow and a good temperature. The amount of fluid you use during an endourological procedure is quite high. It depends what kind of procedure you do. If you do a procedure in a bladder or in a prostate, you need a high flow, so you need a high volume of fluid. During, for example, TRP or laser resection of prostate or a resection of bladder tumor, you have a flow. You need a flow about 100 to 300 mL a minute. So at the end of a procedure, you need, for example, 5 to 10 bags of 3-liter saline. But if you are performing a procedure in a kidney, retrograde, you have a very low flow, sometimes 20 mL a minute. So then you need, of course, a lot less fluid. It is very important that the fluid is warm during the procedures because the patient will cool down. It's very simple. If you have a high flow, the patient will cool down. If you're working with high flow, you can imagine that the patient will cool down quicker. So it's very important to have the patient on quite a good temperature. Well, what kind of temperature you need? Well, you need to avoid hypothermia. Hypothermia it means that you have a core temperature of the patient below 36 degrees Celsius. And if you are under that temperature, there are several side effects you can see in the patient. First of all, it's not comfortable for the patient. Hypothermia in the patient is quite dangerous. It has a lot of negative effects. You can imagine that the cardiac output of a patient will be diminished. The recoverance of the patient will be less good. Patients will shiver during and after the procedure, so it is very uncomfortable for the patient. So a right temperature, a good core temperature is very important during the procedure and also after the procedure. So it is not only important to have a good temperature with the irrigation fluid, but also the rest of the patient should be covered as well. Sometimes we use irrigation fluids which are like less than 37 degrees, and we use it in procedures where we get a lot of temperature release. For example, with a laser, you can sometimes warm the irrigation as well. So, but you can get at the end, you warm the patient higher than 37 degrees. So indeed, in that kind of procedures where you have a lot of energy release during your procedure, we will readjust the temperature to, for example, 30 degrees. It is important to have a good temperature in the irrigation fluid because of the recovery of the patient. It should be clear that good temperature is, of course, not comfortable for the patient, but also after procedure you need to avoid problems in the cardiac output, problems in the infections, the infection chance the patient get afterwards. So it is very important during the procedure to keep the temperature of the patient on the right level. And that will be a level higher than 36 degrees. And you get it with an irrigation fluid from about 37 degrees.
For more information, please visit tsc-group.com. Thank you for watching The Surgical Company. Specialization through innovation.